Welcome back to ABC 7 at 4. March is Blood Clot Awareness Month, and our medical contributor, Dr. Ogechika Alozie with Sunset West Health, is here with some things you need to know about blood clots. We're going to talk primarily about DVT, that's deep vein thrombosis.
Absolutely. So DVT, or deep vein thrombosis, usually happens when you have a trauma, an infection, some sort of thing has happened to your leg, right? And that changes what the legs look like. If you look at this slide, you can see on the left, right, this person's veins don't look right. And the normal vein is in the middle, right? Flow's going, blood's normal. But what happens when you have any of those traumas or things that we'll talk about later is that you can have these little places where the blood pools, the valves become bad, and that's how you get a deep vein thrombosis.
So what is DVT specifically?
So specifically, it's a clot in the legs. So it's a deep vein, so it's not usually the superficial veins, but the superficial veins can lead to a deep vein clot. And so why this is important is that not only can it cause swelling, pain, and dysfunction in the leg, but that clot can actually break off and go to your lung. And when it does that, it's called a pulmonary embolism.
Okay, I didn't realize how serious a problem thrombosis is throughout the world.
Yeah, so up to 500,000 to almost 1 million people a year can have one. And you know, some of these slides sometimes are remarkable, but every 37 seconds somebody has one. Because you got to think about the things that we do. We may fall, we may have surgery, we may have family history, a host of other things that can cause those clots to form because we cause trauma to our veins.
And I've always heard if you're on a long airplane flight, you need to walk to avoid having a DVT.
Absolutely, and so that sort of rolls into what are the risk factors for this. So the things that you can't change, right? How you're born is how you're born. Your genetics are your genetics. You can't change your age, right? But females especially, increased estrogen can cause a deep vein thrombosis. People that have chronic medical conditions, right? You just talked about that sort of being in one place or inactivity, specifically on planes, but it also happens when people have long car drives, and that's something they have to really look at. The last thing too is that if you've been in the hospital or had a major surgery, all hospitals take care of this, but it's something you have to think about if you go home from a major procedure.
All right, let's talk about how you can prevent blood clots.
For me, the biggest thing is understanding what happens when you get one, right? Your leg gets swollen, you're gonna have pain, there may be some tenderness. If you actually have a pulmonary embolus, you can be out of breath, you can pass out, you can have chest pain, and your heart starts racing, right? You have what's called a palpitation, where your heart's going boom, 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 and that's the time to call for help. You can't wait at that point, you gotta call 911.
Now, you can, I wouldn't say prevent, but a specific kind of sock or stocking can help with a DVT.
Yeah, so I think, again, one of the things that you and I always talk about is just try to be healthy, right? Try to be active, try to eat a healthy diet, weight's never great, but specifically to kind of dive into the fact that if you do have veins, whether they're deep or superficial, compression socks can help. I know a lot of people that are supposed to wear compression socks, they hate them because they're tight, they're not cute. I mean, I think the ones on this slide look better, but again, they can help to actually stimulate that circulation if you wear them and reduce the leg swelling.
All right, lastly, the local resources available to help people with blood clots.
Yeah, so I broke this into two pieces. At the top are the hospitals. That's the 911 piece, right? If you actually feel that you're having a deep vein thrombosis or, God forbid, a pulmonary embolism, you got to go to the hospital. And all these hospitals are well equipped to treat this. The other side is that prevention, right? When we talk about some of those superficial veins that can lead to DVTs, whether it's the El Paso vein doc or artery and veins or vascular specialist, I think there's a host of resources. If you have those veins, talk to your clinician, get a referral, and potentially get them evaluated, get them lasered, and possibly just wear compression stockings, which are a lot cheaper.
Dr. Ogechika Alozie, ABC 7 medical contributor. Thank you, sir.
Thank you, sir.